More than 500,000 children get tonsillectomies each year, making it one of the most commonly performed pediatric procedures. In our first story we have today, a 3-year-old had her tonsils and adenoids, and that's typical, removed together. Nearly a week later, without warning, she started vomiting a large amount of blood. As she vomited blood, massive clots were hanging from the back of her throat. Mom obviously frantically called 911. When the medics arrived, they made sure for Mom to take pictures so the docs in the emergency room would know exactly how much blood her child lost. That's such a key. So after being stabilized in the ICU, the girl spent 2 nights in the pediatric unit. Mother knew that one of the complications after tonsillectomy was bleeding. However, she never expected this.
Because we have to prep parents, right? I mean, it's like, I tell parents, I'm like, this is gonna be 2 bad weeks for sure. And that's without complications. It's one really awful week and one pretty awful week.
And you as a family practitioner.
Interesting because it was a week later. And I think even though the mom kind of expected that it might be rough, I don't think she expected it to be this much blood.
I think after a couple of days, you take that deep breath.
And in all of our specialties, we can see that. We can see acute early bleeds.
Absolutely.
And we can see late bleeds. And typically, the late bleed is related to a clot that's formed, but is dislodged, and then boom, you start bleeding. I'm guessing in this case that the bleed was related to the adenoid part, which is back up in the pharynx, right? You can't see it, so I'm guessing this clot was sitting there. Nobody knew. Something dislodged it.
Yes.
Started bleeding, swallowed the clot, and we know how irritating dried blood is to the stomach. The minute you start swallowing blood, you're gonna vomit. And the minute you start vomiting, it makes the bleeding worse. But to your point, Dr. G, the whole thing with tonsils have shifted. In my era, I had my tonsils removed in the 50s, and it was in. Everybody had their tonsils removed, boom. 80s, while I was a resident ear, nose, and throat, we were still doing it, but the criteria appeared then. You have to have X amount of cases of strep throat in a year. You have to have large tonsils. You have to show repeated problems with your ears.
And when you meet those criteria, you can make a whole family's life better by doing a tonsillectomy.
Yeah, but then the climate changed a little bit in your era where let's not go removing tonsils so quickly. They serve a function.
Yes.
They may be there for immune reasons.
Absolutely.
But now, in this day and age, it's gone back to them because of the airway obstruction issue. We know that if you have air obstruction, you become a mouth breather, can't breathe through your nose, that it's going to change your face, affect your sleep. So now it's shifted.
And then your weight. You're more obesity if you're not sleeping.
All of those things that you see in your practice.
And it just makes me think of something in general, not necessarily this case, but Mom said she never realized how long after the surgery and how suddenly complications can occur. And so just informed consent. So not saying that she wasn't informed, but in general, sometimes you hear people say, oh, we're gonna go in, we're gonna do this, you'll be great, you'll go home, it'll be good. That's not informed consent. You really want your doctor to have a conversation with you and talk about the risk of bleeding and infection. So if you're not hearing any complications, that's an inappropriate conversation, and you need to say, well, what are the potential risks? And it's not that you won't have the procedure, it's just that the parent or the individual needs to be informed about the things that can happen, and every surgery comes with risk.
I've always thought about surgery like this. Surgery does 1 of 3 things: make things better, worse, or they don't change. But there's always a possibility. Think about it. Absolutely does. And there's always that possibility of an unexpected risk, like bleeding. So we have to be aware of that. And you said it so well. Like, there is no such thing, even if it's a removal of a toenail or a fingernail, as a minor procedure. Surgery is never minor. It's always specific, and something can always happen.
Well, we know for parents this could be so traumatic, and seeing your child in a condition like that would freak out any of us.